Hello everyone, welcome back to our channel CPC Adda. Today we are going to see exam pattern, how many questions they are going to ask and what type of concepts they will ask from each topic. We'll discuss in this video. Okay. So first, this is as you know, this is online based exam and having 4 hours of time, and they will ask 100 questions and you have to score 70 correct questions to pass the exam, right? And these are the topics what you are going to receive in the exam: anatomy, medical terminology, anesthesia, integumentary system, musculoskeletal system, respiratory and cardiovascular system, and digestive system, genitourinary system, nervous system, radiology, pathology, laboratory, medicine, evaluation management, SCPCS coding guidelines and coding guidelines, ICD-10 CM, compliance and regulatory, and case studies. Okay, these are the topics you are going to receive in the CPC exam, right? So, while starting with the anatomy section, you will get the 4 questions and all related to your human body anatomy. Okay, human body anatomy, all systems you should know, and all body parts, body organs, each and everything you should know. So where they may ask like which body organ belong to which type of system, okay, which gland belongs to which system. These type of questions they will ask, and what is the small part of the uh, body, okay, a small organ in the body, like that small bone in the body, large bone in the body. These type of questions they will ask from the anatomy section, okay. And next, medical terminology section, there are also 4 questions they will ask in medical terminology, but they they ask, they will give the questions like medical terms they will give, and they will ask the what is the meaning for that, and they will give synonyms for that. They will ask synonym one name they will give, and what is the synonym for that, like that questions you will get from medical terminology. Sometimes you will get the uh, questions like prefix and suffix. They will give half what of the word, and the remaining half what they will ask you, okay. And some times they will give you one word and they'll ask the meaning for that, okay. These type of questions from come from medical terminology part. And then anesthesia, from anesthesia also you can expect 4 questions in this exam, okay. So for anesthesia you have to see what is the anesthesia, and how many types in anesthesia, these things you have to know, okay. And then you have to see what are the included services in the anesthesia, what are the not included service in the anesthesia, and what are the modifiers using an anesthesia, and how you can report the time reporting concept you have to know. And physical status modifiers also you have to study, and qualifying circumstances you have to study. Moderate sedation also you have to study, and billing for anesthesia, how you can do these things you should know, okay. What is the time unit, anesthesia time unit, these things you have to know from anesthesia, okay. And then we'll go to the next topic, integumentary system, one series codes. There they'll ask 6 questions from this section, okay. In these 6 questions they will cover the different topics like excision of lesions, adjacent tissue transfer, skin grafting, Mons surgery, incisional drainage, debridement, biopsy, removal of skin tags, shaving of epidermal lesions, and repairs and closures. All these topics they will ask, okay. From these topics they will ask you 6 questions, right? Then next topic, musculoskeletal system, 2 series codes. So here also they will ask you 6 questions. In this section you have to see arthrodesis topic, you have to concentrate. Arthrodesis, bone grafting, fractures, dislocations, manipulations, amputations, application of cast and splints, straping. These things you should know from this section, musculoskeletal system. Here you will get the 6 questions, okay. And then we'll move to respiratory and cardiovascular system, 3 series codes. Here also you will get the 6 questions from this section, and the topics what you need to study here is CABG. Okay, coronary artery bypass graft and pacemaker defibrillator you have to study. Central venous access procedures also you have to see. Interventional radiology, sinus endoscopy, laryngoscopies, these things you will receive from this section. Okay, and then we'll see about the digestive system. There also you will get the 6 questions. The here you have to focus mainly on hernia repairs. Okay, hernia repairs, laparoscopy and sigmoidoscopy. These questions you can expect from this section. Okay, mainly you have to study hernia repairs. Okay, and then genitourinary system. Okay, urinary systems you have to cover here. Urinary system and female genital system and male genital system, these things you have to cover. This is five series codes and 6 questions from this series you can expect in the exam. Okay, here mainly you have to see maternity and delivery, and in delivery also it is vaginal or cesarean deliveries, and intersex surgeries also you have to identify here, and normal urinary system things also you have to, like nephrectomy, these things procedures also you have to cover from this section. Okay, and next you have to see nervous system also. Here also you can get 6 questions. Okay, that is 6 series and you can get 6 questions from this topic. Okay, here you have to focus mainly on craniotomy and craniectomy procedures, nerve blocks, lumbar laminectomy, these things you have to see. Okay, mainly nerve blocks, craniotomy, craniectomy procedures, and lumbar laminectomy. These 3 topics you have to cover first in this topic, nervous system. And then we'll go to the radiology section, 7 series codes. Here also you will get the 6 questions minimum in the exam. Okay, and you have to study here x-rays, you have to see CT, you have to see MRI, MRA, and ultrasound, venography, and myocardial perfusion imaging studies, radiation treatment management. These all these topics you have to cover from radiology section. Okay, and then you have to see laboratory and pathology section, that is 8th series. From here also you will get the 6 questions in the exam. Okay, here you have to see panel coding and drug testing, that is presumptive drug testing or definitive drug testing, clinical pathology consultation, surgical pathology, urine analysis. All these topics you have to cover in this section, laboratory and pathology. Okay, panel coding, drug testing, clinical pathology consultation, surgical pathology, and urine analysis. And then medicine section. Medicine section you will get the 6 questions, that is 9 series codes. You will get the 6 questions in exam, and here you have to see mainly immunization and vaccination, dialysis, psychiatry, and IV hydration. Okay, immunization and vaccination, dialysis, psychiatry, and IV hydration. And next topic, evaluation management. Okay, in evaluation management this is 99 series codes, and here also you will get the 6 questions in exam. Okay, in this evaluation management you have to see all types of visits, like inpatient, outpatient consultations, office visits, home health, and emergency coding. All these visits you have to see, and same day admit, discharge, and you have to see from this evaluation management. And also you have to identify initial visit or subsequent visit or discharge visit or same day admit visit, and critical care services also you have to see. You have to focus mainly on neonatal critical care things. Okay, and then you have to see on HICPICS. HICPICS based mainly the services what are not covered in CPT, they are covering in HICPICS. Okay, durable medical equipment things you have to code from here, and you can see um, supplies codes also will be there. Okay, so these are all are direct questions only will come from the HECPICS. Okay, then coding guidelines and ICD-10. Uh, from these 2 sections you will get 7 questions plus 5 questions. Total 12 questions you will get coding guidelines and ICD-10 CM. ICD-10 CM you will get the questions like they will give the scenarios and they'll ask for the code for ICD-10. Uh, diagnosis codes they will ask you. So like that questions, 5 questions you will get, and all they will ask like diagnosis codes. So you should be strong enough in ICD coding. Okay, and then guidelines they will ask like, see, all ICD, CPT, HICPICS books you have to refer, and what are the conventions available, all the symbols you should know in book, and the sequence of coding you have to see, modifier based questions you will get, and combination codes, acute and chronic conditions, sequela, and laterality, borderline diagnosis, excludes 1 and 2, and anemia due to neoplasm guidelines, and diabetic uncontrolled, these things guidelines you have to see, and Castillo classification of open fractures also you have to see, and poisoning also you have to see, burn care also you have to see, burn care coding guidelines also very very important, and pregnancy complications also you will expect questions from that. Burn care and pregnancy complications, poisoning, very very important topics. Okay, and then compliance and regulatory topic, there you will get the minimum of 3 questions in exam. Okay, so here you have to see Medicare parts, all Medicare parts A, B, C, D, and you have to see, and what are the claims, and how many are there, that thing you have to see, and ABN and ABN related information also you have to check, and what is NCCI edit, these things you have to see, and LCD and NCD also you have to see, and place of service, RBRVS, HIPAA, high tech, all these things you have to see. Okay, and at last, case studies. Case studies you will get 10 questions. Okay, so case studies is a very very important topic. Okay, and also complicated topic. So whenever you give complete attention to the topic, then only you can survive from that. Okay, so these are integrated into different sections like CPT, ICD-10, even HICPICS. So case studies present real world patient scenarios where you will need to analyze the medical records, reports, or clinical documentation and code them accurately. Okay, so for example, you might get a scenario where a patient undergoes a procedure, and you will have to identify the correct diagnosis and procedure codes, including any necessary modifiers. These questions are more complex and require you to fully understand the patient situation, the medical services provided, and how to apply coding guidelines. Okay, all these things you should aware while dealing with the case studies topic in your exam. So my advice for case studies is to carefully read through the scenario, identify key terms, and think about the medical necessity for the procedures or diagnosis. Always follow the coding hierarchy. Start with diagnosis, then procedure, then finally any additional details like modifiers or supply codes. Okay, so all the best for your exam, and thank you for watching. If you like this video, please like, share, and subscribe for more information. Follow our channel CPC Adda. Thank you. Bye bye.